Thank you, Mr. Chairman. And I think the benefit of having the President in Baltimore is that we did give him the package of GOP.gov, our solutions, which address many of these healthcare questions. And I would encourage my colleagues on the other side to take a look at those, because I do think there are, Madam Secretary, when we met with the RSC before the bill moved to the floor, I did talk about private insurance, a national health exchange, and a way to do it in a market-based solution. The Democrat leadership did not decide to go in that manner. I hope we relook at that. If we really want to move legislation to provide health care to all Americans, there is a compromise out there, and you can model it after Medicare D. That's what I proposed over, I don't know if it was a year ago, 8 months ago, but we could really get there if we shelve the centralized control, one big government solution, and go back to the market. But for my questions, according to the Congressional Budget Office, the House-passed health reform bill will add over 15 million Americans to the Medicaid rolls, producing $34 billion in unfunded mandates on states during the 2015-2019 period. Now, this is following up from Mr. Deal's question, which he asked, has any governor said, no, this is a bad idea? You failed to answer that question, and I'm wondering if, based upon, did you have any governors say, I don't want these additional unfunded mandates, because we know Medicaid requires the state, some states a 50-50 share, some states 70-30 share, depends on the state. Do you have any governors that said no, don't do this? The Medicaid expansion is bad. We can't afford it.
We have had governors who have expressed that they want more adequate federal funding if there is expansion, and other governors who are very enthusiastic about the plan. So we've had both.
So there are 35 states right now moving referendum against this, and I think the Virginia Senate just passed legislation through the Virginia Senate against the expansion of Medicaid, because
my understanding is that Virginia issue deals with a mandate to purchase insurance coverage.
Yeah, well, I think the 35 states
Medicaid.
that are, yeah, and we can address that, but the issue is the states are saying no, they can't afford it. Illinois is broke, California's broke,
and many states, as you know, Representative, are already exceed the 133%. So we have states that are kind of all over the.
I would just say that expanding Medicaid to states who can't afford to expand it by a mandate, and that's where the debate comes. So then the federal government, which doesn't have a balanced budget requirement, that many states do, that's where then we pick up the tab and we go into historic national debt as we find ourselves today. Would the President sign the Senate Health Care Reform Bill into law as it is alone?
Sir, you'd have to ask the President. Maybe you did in Baltimore.
Let me set the groundwork. When you came here the first time, the health bill was just in draft form, so you refused to ask any questions, take any questions on the health reform bill. You promised to return, which that never happened. So a lot of the frustration today is not having a chance to talk to you in the committee process to debate health care reform that was going to go through this committee. So that's where a lot of this angst. And now we're only given 2.5 hours. No one's allowed to give opening statements as a whole, and then they did extend it for an hour, but we had two votes in between, and that's part of the incredible frustration here. So does the President support cutting $500 billion from Medicare, as do the Senate and the House reform bills? Yes or no? I'll use the John Dingell approach. Yes or no?
The President supports the health reform.
So he supports cutting $500 billion from Medicare.
Supports making sure that Medicare is solvent into the future.
So that's a yes.
The overpayment.
The President supports cutting $500 billion. The Senate bill says $500 billion. The House bill says.
Well, they had different numbers in them, but the President.
So the President supports cutting $500 billion in Medicare.
The President
yes or
was
no?
Supportive of the health reform legislation.
Is that a yes?
I said yes, sir.
Okay, thank you. Let me just talk about one issue that was hit on Mr. Whitfield. These 3 counties are what we talk about as Gatorade, the negotiated deal that Florida cut for their Medicare Advantage folks. These 3 counties, Palm Beach, Broward, and Miami-Dade, will not feel the effect of the Medicare cuts for Medicare Advantage. Was HHS involved in negotiating this deal with the Senate?
Sir, I was not.
No HHS staffer was involved?
Gentleman's time is over.
Okay. Thank you.
Sure.